Perhaps you've just been diagnosed with diabetes, or maybe you've just decided now's the time to do something about it. The best thing for you to do is sit down with your doctor, your healthcare professional, or your diabetes educator and develop a plan. Everyone's diabetes is different. A pharmacist one time figured out there's like 1,400 different treatment regimens, different kind of medications you could be in, different combinations of medications. There's a lot of different medications for diabetes out there right now. I'd also like to mention that if you have not been to your doctor recently because you think they're just going to tell you the same old thing, please go back. Things have changed a lot in the last 3 to 4 years. Lots of new medicines, they work on different things, they work in different ways, new ways of giving insulin. So make sure you keep up with your physician. But everyone needs to have an individualized plan, something that works for you and something that you can do. Because if I develop a plan for you and you say, I'm not doing this anyway, it doesn't really accomplish anything. So we can work together on discussing that to figure out, do you need to lose weight? How much weight do you want to lose? What do you think is realistic for you? Do you think you can lose 10 pounds in the next 3 months? Do you think you can, what kind of things are you willing to give up? What kind of things can you just change? Can you go from regular sodas to diet sodas? Are you willing to give up 4 pieces of bread at breakfast for maybe 2? Can we switch from croissants with sausage on them, which is very high fat, to maybe a muffin with Canadian bacon or a lower fat egg on it? So there's a lot of things that you can do to make little changes in your diet. We need to look at your activity level. I don't think you need to exercise per se right off the bat, especially if you haven't been, but just increasing your activity, sweeping the front porch, raking the leaves, pushing the lawnmower instead of doing a riding lawnmower. Instead of hiring someone to do your lawn, do it yourself. Joining a club, take dancing lessons. If anybody's been watching Dancing with the Stars, everybody talks about how much weight they lose. So take dancing lessons. Get yourself out of the house. Identify those times when you tend to snack more and see if there's something other activity you can do to get you away from the snacking. Another thing you can talk with your educator then is about the medications you need. Some people are able to manage their diabetes very well with just changing the kind of food they eat. Perhaps again, you have to look at what you're eating, how much you're eating. Maybe it's not the fact of what, but how much. So there's a lot of different variables there that you need someone with some expertise that can help to give you some suggestions and pointers. Sometimes medications are necessary. There's the oral pills. Some pills work on the pancreas, some work on the liver, some work on the cells, some work on your gut. So there's a variety of pills that all work on different areas. Most of the time, your doctor or healthcare professional will start with one and see how that works. And then they'll add another one and add another one. Most of the pills are not instead of, but they're in addition to. One pill, the pill that works on your pancreas does nothing for your liver and vice versa. So you might be on a pill for your pancreas, a pill for your liver, a pill for your cells, a pill to aid in digestion or the emptying of the carbohydrates from your gut. So again, work that out to see how that works. Now you're going to know how this is working because you're going to be checking your blood sugars. That's the only way, that's the best way we have to actually assess it and determine that the treatment regimen that you've agreed on is working well for you. Some cases, if your blood sugar is extremely high first coming into the doctor, say if it's in the 300s, they might put you on insulin right off the bat. Now there's some controversy about that, but our opinion is once you're on insulin, you're not necessarily always on insulin unless you're type 1. Type 1 patients make no insulin whatsoever. For some reason, their pancreas has quit making insulin and they have to take insulin by injection. Most of the time, 2, 3, 4 times a day. Type 2s, which can be children, teenagers, adults, type 2 diabetes is, again, very often controlled with weight or oral pills, or in some cases need replacement insulin to help to maintain a normal sugar. So again, work that out with your doctor. There's several different types of insulin you can take. There's very quick-acting insulin, there's intermediate-acting insulin, and there's long-acting insulin. So again, depending on the time of day as to when your sugars are out of range, depending on your activity level, depending on your work schedule, depending on what you're willing to do. Some people will say, I'm not taking more than 1 shot a day, that's it. So I have to choose very carefully then in where do I think I'm going to get the most benefit from what type of insulin would benefit that patient the most. So again, look at all those different options and put away some of your preconceived ideas. A lot of patients come to me saying, well, you know, my grandma, she took 4 shots a day and boy, it just didn't work out. Well, your grandma had a very different kind of insulin. You know, the same thing when people say, well, you know, I can't learn to do this. You learn to use a cell phone. Almost everybody has a cell phone. You might not have learned to use a computer real efficiently or proficiently, but most people can do a little bit with a computer, so you can learn this. It's not that hard to do. But the key is finding someone who's willing to work with you, willing to set up a joint plan with you, because what I want you to do might not be what you want. So we have to come to some common ground and decide what your goals are. Do you want to lose weight? Some people are very happy just the way they are. So if you're not interested in losing weight, there's no point in me talking about that this time. So again, work with your healthcare professional, develop a plan. Keep in mind that everyone's different. So when you're sitting at church or talking to your sister-in-law's new boyfriend or run across somebody in the lab and they go, well, this is what I do for my diabetes. Keep in mind why you and your physician or your healthcare provider chose the plan they did for you and whatever works best for you.